Are you worried about osteoporosis? Then you should calculate your FRAX score. FRAX score is an objective way to assess the probability of getting fracture in next 10 years. It is a standardized tool by WHO and it is accepted practice since 2008 and is used worldwide. FRAX score takes into consideration your age, your sex, your height, your weight, your previous risk factors like having a fracture if you're a smoker, alcoholic, and also it takes into your medical disease burden which make you predisposed to take certain medication, especially steroids, that leads to increased bone turnover and put you at high risk for osteoporosis. It is a tool which is available all over the internet and we will also put a link in the description. You should calculate your risk. It gives you beautifully your risk of fracture in next 10 years. If score is low and you have a very minimal risk of developing fracture in next 10 years. If you are in a moderate category, you have about 10 to 20% chances of developing osteoporosis related fractures and 3% risk of developing hip fracture. That is the one which leads to a lot more pain and suffering, and that's what as a medical community we care a lot. You can change your FRAX score. That's the beautiful part. It's a tool to create awareness that if you change your lifestyle, we can't change our age, we can't change our sex, we cannot change our height, but we could change our weight, we could exercise, we could stop smoking, we could stop drinking, and we could treat our chronic medical problems safely and effectively so that our bones do not become weak and fragile and we don't develop osteoporosis. I hope you will use FRAX score if you're above the age of 50 to calculate your risk. This is a first step to become aware about osteoporosis and changing your lifestyle so that you could make positive changes to prevent pain and suffering in future. This is Dr. Kundlas and I will see you in next video. Please do not forget to like, share and subscribe to our channel. Thank you very much.